Hello, welcome to Civic Conversations. I'm your host, Marvin King. On today's episode, we have Dr. Hannah Allen King, the Executive Director of the William Magee Institute for Student Wellbeing and an Assistant Professor of Public Health at the University of Mississippi. Dr. Allen King's research focuses on mental health issues and substance abuse, especially as it pertains to college students. In that regard, on today's episode, Dr. Allen King will talk to us about gambling as a public health issue and how the William Magee Center at the University of Mississippi is tackling this issue. Hannah, welcome to the show.
Thanks for having me.
Well, glad you could be here. To help us get started, how pervasive do you believe gambling is on college campuses?
Yeah, so it's actually really tough to get a good estimate on this because a lot of the research that's currently in this area is either non-existent at a national level. So we have a lot of really good ongoing data sets and access to data if we wanted to estimate mental health issues or substance use issues of prevalence at a national level on college campuses. But unfortunately, we don't have the same type of data and research that's being done on college students related to gambling behavior. So it's tough to nail down a number. And that's actually a big reason why I think that we need more research in this area. There have been some estimates, but I can cite that because of sort of this lack of national data, last spring in 2025, we did a statewide survey of the IHL universities in the state of Mississippi. So it was 8 different colleges and universities. And we did a brief survey to start to capture the prevalence of gambling and sports betting among college students in Mississippi. And so we found that in the past year, about 40% of students had gambled in the past year. And that was any type of gambling. So playing cards, playing the lottery, betting on sports. But we also think that that might be an underestimate because there were some types of gambling that we didn't even include on that survey. So for example, the sort of emerging prediction markets, even thinking about people that engage in day trading or betting on crypto or any other type of financial risk. So I think that that might also be an underestimation of how prevalent it is on college campuses.
And perhaps maybe some students just don't feel comfortable admitting, even in an anonymous survey, to any sort of gambling.
Yeah, absolutely. Any type of survey research, you're always going to have what's called social desirability bias. So anytime that there is a question that someone might think that whoever's reading the data, even if they don't know who you are, you're still going to want to answer in a way that is more favorable. So if someone asks you about your alcohol use and how many drinks you have a week, maybe it's 10 and maybe you say 7. So we can always sort of think that the estimates that we're going to get on surveys, especially with these types of topics, are going to be underestimates. But from that data, we saw that about 40%, which is a really large population of college students, are engaging in some type of gambling in the past year.
Well, we certainly deal with social desirability bias in political science when we're asking people who they're going to vote for. I know that doctors deal with this when they're asking their patients how many drinks of alcohol do you have in a week, and the number is usually pushed down, rarely is it pushed up. Yep. So this social desirability issue, as you've described, is very common in the social sciences. So that's something that is no surprise that it would be applicable to gambling. So I guess what that means is, do we have a way of knowing if the scale of the problem is changing? It sounds like we don't really have the hard data, but maybe there's just more awareness of the issue. Is that accurate?
Yeah. So without this sort of longer term data collection that we really need, it is hard to make a definitive statement that prevalence is increasing, especially among different groups. But we can make an assumption just sort of by nature of looking around at some different sort of cultural touch points that we are seeing that this is becoming a more prominent behavior, or that other things are increasing, like advertising is increasing, the amount of platforms that are being used, online platforms, mobile apps that are available to gamble, the different types of markets that are available. We can see that those are all increasing and therefore increasing availability. And based on what we know about other behaviors, the more available something is, the more it's going to be used. So we are working to try to have better annual data that's collected at a minimum here at the University of Mississippi, but we would love to see more statewide and national data that's collected every year so that we can have more definitive statements to know what those trends are in terms of prevalence on the rise.
Sounds like a grant proposal right there.
Yeah, and that's a tough one because there's actually not a lot of accessible federal grant funding right now for gambling. So if we think about, as a public health researcher, the types of grants that I might write might be to NIH or SAMHSA to do research on substance use or mental health. We don't have a good outlet for federal research for gambling. And so that is why I think we lack a lot of good information, is because right now there's not a lot being funded for people to be able to actually do this work. So one of the big sort of pushes that I would like to see change is, as we see this become more of what I think is a public health issue, is that we would see more federally available grants or state level grants or foundation grants that will fund researchers that are interested in doing this work so that we can have better numbers.
Well, it also seems that part of the need here, not only for additional research dollars, is that college students, and correct me if I'm wrong, are they a particularly vulnerable population to gambling? What I know about child psychology and the development of the brain and impulse control, does any of that factor into making college students a particularly vulnerable population, or what might make a population vulnerable to gambling?
Yeah, there's a lot of reasons why college students in particular are a more high-risk population for gambling, and there is data that has shown that they're more that they gamble at more at a higher prevalence than the general population. And so there's a few reasons why that is. One is that young adulthood and adolescence are just developmentally appropriate times to engage in risk-taking behavior. So there's sort of that a little bit more of a lack of, I might experience consequences from this, that we have more as we age. And so that's why we see higher substance use levels as well, and just higher engagement and more addictive behaviors, is because of that risk-taking that really is very developmentally appropriate for adolescents and young adults. We also see that because there is high substance use at this time in life, that there is also an overlap between those risk-taking behaviors. So we do see that one behavior is kind of bidirectional, that increased substance use can lead to increased gambling and experience consequences can also lead to increased substance use. So those different types of risk-taking behaviors can go hand in hand. We also see that there are not college campuses, there's not a lot of clear policies and guidelines around gambling on campus. And so that can also lead to, once again, increased availability, not a lot of consequences that students are experiencing, or different clear policies on college campuses. And we're also just seeing a big increase in, like we were talking about, in availability. So when these larger gambling companies are creating apps and advertisements, they are targeting youth and young adults. And so we've seen this in the past when we think about what were ads looking like, they were targeting smoking, alcohol use. We're seeing that how they are framed and what those advertisements look like. They are targeting youth as a big consumer of this type of behavior. And we're also just seeing pretty rapid changes with state and federal policy. So sports betting, the Supreme Court ruling was overturned in 2018 to then legalize sports betting nationally. And now we're seeing that a lot of states has also legalized mobile and online sports betting and gambling. And so it's not really what it used to look like in terms of only having a person casino gambling. So now we're seeing this whole new world of a lot of technology-based gambling, and who are the folks that use technology or youth and young adults. So there's a lot of kind of factors at play about why this is a particular population that really is at high risk for this type of behavior.
So once upon a time, if you wanted to gamble, you had to go to Atlantic City or Las Vegas. And now technology, like so many things, has put the best of the world in our pockets in a phone, but also the worst of the world in our pockets at a phone. And so the availability is so tempting. Is there some definition or standard or scale that turns a problem from a localized problem of that person is addicted, too bad for them, into a public health matter?
Yeah, I mean, I think if you ask anyone in public health, they'll make an argument that everything is public health.
Okay.
I think that's the standard, is like, it's kind of like that, I could play that game of like, give me any topic and I can tell you how it's a public health issue.
I love that.
for this one in particular, I think that it's not a hard jump to make because we are seeing that there's clear health and well-being consequences that someone can experience. So an important thing and a stance that I always take is I don't focus on abstinence from any type of health behavior. So, I don't think that we should necessarily need to outlaw alcohol or or tobacco use or things like that. But it's all about harm reduction. So how can we recognize that the majority of people are going to be able to engage in a particular behavior and not have any type of extreme or long-term consequences from that behavior? But there is a portion of the population that is going to experience problems or consequences from that particular behavior, which is where public health really wants to step in. It's how do we prevent and educate people that are going to engage in that behavior to do it safely and do it in a way that is going to reduce harm. So that's kind of where we are with gambling, I think, in the public health world, is thinking about how can we prevent and educate the general population and college students and youth and some of our more high-risk groups to say, listen, this can be something fun and entertaining. We're not taking any sort of stance on legalization or policy, but it's all about making sure that, particularly with young people who are susceptible to experiencing consequences, how can we educate you on how to gamble in a way that is going to be healthy and not detrimental to you? And then for those that are experiencing consequences, we have to have safety nets in place to be able to screen and find those people. And then once we are alerted that someone is experiencing consequences, make sure that we have a treatment and intervention network in place to be able to help them to stop experiencing consequences. So public health always takes a stance of wanting to be preventative. So thinking about, we're living in this world now where we have more legalized behaviors in a particular area, and it is a behavior that can be linked to some negative consequences. So public health says, let's prevent people from experiencing those consequences as we see that this behavior is becoming more common.
Well, again, I think we're seeing a lot of parallels to, for me as a political scientist, I think when you're saying abstinence is not really the solution here, my first thought went to prohibition. And we all know how well that worked. It worked so poorly that we ended up having to repeal prohibition. It just increased crime and did not decrease problem drinking. And so we kind of learned, well, hopefully, I say we learned a lesson there. And so we see this, I'm sure, on a different episode, or you've got colleagues who could talk about sex education and, in the schools, and how to talk about, okay, this is something we know people are going to do, yet there are consequences if you are not careful and intentional and considerate. And so it seems like gambling has to be there too. But if people are afraid to talk about it, then you can't come up with solutions and research to really address it, which brings me to this question. So besides your work as a research professor, you also serve as executive director of the William Magee Center. And so before we run out of time, could you just tell us briefly about the Magee Center and the efforts the center is taking to learn more about gambling? Because I know that there's some recent efforts there to expand the scope of the Magee Center.
Yeah, so there are two, actually, and it's very confusing. There's the Magee Center and the Magee Institute, and they actually operate separately, but it's complicated.
Well, super. Clear it up for us.
So the Magee Center serves the University of Mississippi internally as part of student affairs. And so they are the ones that do a great job with alcohol and drug prevention and wellness education, specifically on our campus. So they're sort of the student-facing piece to that puzzle. A couple years ago, the founders of the Magee Center and the Magee family wanted to expand that out, and so then created sort of this parallel Magee Institute, which is meant to be more of the research arm or the external arm to the Magee Center's mission. So I'm the director for the William Magee Institute, which sort of means that I think about what can we do to expand beyond just the University of Mississippi to think about college student health, not only for our students and how we can use research to inform the work that we do here at Ole Miss, but then also to be able to expand externally, think about grants and larger studies that are beyond just the walls here at the university. So the Institute is meant to house different centers and labs. And so we have different topics that those centers and labs focus on, like substance use, mental health. And so as we've seen this gambling issue grow, we wanted to start an additional center at the Institute focused on collegiate gambling. So we just recently, back in February 2026, got IHL approval, sort of administrative approval, to be able to then house the Center for Collegiate Gambling within the William Magee Institute. And so the goal of that center is once again to become sort of a national resource on college gambling, both gambling by college students, but also thinking about gambling on college sports and thinking about our student athletes, how that might affect them. So we really want to not only address this issue on our campus, but think about how other campuses that are wanting to address this issue can look to us as experts in the field to provide prevention and education resources, potential treatment options, policy recommendations, be research partners and collaborators, because there are other folks across the US that have been doing work in this space. And so we want to capitalize on building out those relationships and sort of once again become a hub of resources to be able to help get some of this research done and moving forward.
I hope that the policymakers in Jackson and DC pay attention to your research and not just listen to industry, which, in my role in political science, we see that a lot, where industry has an advantage in being able to reach legislators. And so hopefully that they'll also pay attention to the research and learning about the effects of this. Once again, I'd like to thank our guest here, Dr. Hannah Allen King, Assistant Professor of Public Health at the University of Mississippi, for taking time to appear on Civic Conversations. And so to close it out, what articles or books might you recommend to listeners who want to learn more, maybe have an interest in public health or gambling in particular?
Yeah, so there are a few good websites that I think would be great, because there was one that the two major foundations and groups that focus on gambling nationally are the NCPG, which is the National Council on Problem Gambling, and then the ICPG, which is the International Council on Problem Gambling or Gaming. Don't quote me on those. But they've both developed good websites that have a lot of resources that I think students would benefit from, that link to different articles and readings and other resources as well, and also have different screeners that students can take if they think that they might want to know a little bit more about their own gambling behavior, and if they're starting to creep into maybe that territory of where it would be beneficial for them to seek additional help or have conversations. So there's collegegambling.org, which I think is the one that is the ICPG website. And then the NCPG website, just their main website, has a public resources page that links to a lot of different resources that I think people would find really relevant, both on gambling at large, but then also college gambling. And one of the things that I would like to see come out of the center as well is to be able to have like our own website where we can also link to additional resources that people might find interesting.
Well, I'm sure that'll happen, hopefully sooner rather than later. And it sounds like a great program that will serve not only students here at the University of Mississippi, but eventually everybody around. Thank you again for your time. Hopefully we'll be able to have you on again in the future. Once again, Dr. Hannah Allen King, thank you very much.
Yeah, thanks so much.